of our meetings said, you know, we're doing so good now. We've got so many moms breastfeeding. We should get this baby-friendly award. And we literally at the table said, what's that? I didn't know what it was. I said, what is that? They said, well, it's an award you can get. If you're doing these, supporting breastfeeding, you can get this award. We said, well, yeah. We said naively, yeah, what the heck? Let's get that. So they said, well, we have to be paying for our formula. We all said, paying for our formula? I said, well, are we? Nobody knew. We didn't even know. So we went to look and we said, oh my gosh, we learned that if you got the bags coming in, that probably means the formula's coming in for free. So then I had the arduous task to try to find our contract about this. Finally found it, and this was the contract. And you can see here that this was 1998, effective immediately. The following products will be given to Boston Medical Center at no charge. And these are all of the products, formula, Pedialyte, all this stuff. And down here's the diaper bag. So we said, my goodness, we are getting our formula for free at this hospital. We can't get this baby-friendly award unless we pay for our formula. So if you were to read through this, it said that this said Ross Labs would give Boston Medical Center, this is the standard contract that all hospitals have, Ross Labs would give Boston Medical Center $6,000 a month of free stuff. So that meant that 6 times 12, $72,000 a year is what we're going to need to pay for this formula. And we were really psyched now to get this award because we thought it would be really cool because no one else in Massachusetts had it. We thought it would be cool. So the word on the street quickly became the crazy breastfeeding crowd needs $100,000 for some award that they want. And we were like every other hospital in the United States. Budget was really tight. We were in a deficit. People were being laid off. So I went to meet with the CEO of the hospital, stupid old naive me, and I said, you know, we'd like to get this award, and we think it'll cost about $72,000. No discussion, no. We're not doing it. So I took it back to the group, and we were very, very glum. And everybody sat there, and we're glum for about 3 minutes, and then people said, we're not going to take this, we're going to keep going. And then someone raised their hand, I think it was Dr. Frank, and she said, that can't be right. We can't be spending that much money on formula because everyone here is breastfeeding. She said, we need to do an audit. We need to get the data. And then let's get the data. So everybody in the group, we got all excited. They said, go back to your units and for 1 week, count bottles. Just count bottles. How many are you using and bring the data back. Then we had to figure out how much the bottles were worth. So that was hard. So we figured 15 cents a bottle. So we came up with a figure of $16,000, not 72. It certainly wasn't 100. We knew this said 72, but we came back with a figure of 16. So we had all the data. So I took it back to the CEO, and at this point we had the support of my chairman of pediatrics, the chairman of OBGYN, the chairman of family medicine, who were all making phone calls. Hey, I think we should do this. And the CEO said, you know, I think we're going to do this. One, because it wasn't going to be a lot of money, that much. But because it's the right thing to do, and to her credit, she has stood by this program because she felt it was the right thing to do. The motto for our hospital is that we offer exceptional care without exception, and she really felt that that fit our vision for our hospital, that this was truly exceptional care without exception. So in December 22nd of 1999, we became the first baby-friendly hospital in Massachusetts and the 22nd one in the country. And this was in the end of 1999. So we had a party. The hospital paid for the party. We even had a piano player. It was really nice. And these are two officials. These were the co-chairs of the meeting. This is me. This is Rebecca Gade and Susan Manier. These are two officials from Baby Friendly USA who came to give us the award. So that was great. But the point of all of this is maybe this is the answer for our country because you've got to get breastfeeding going in the beginning or it doesn't work. So this program looks at the beginning. So this is our research, which is to say, does it make a difference? And we're an academic institution that does research, so we're one of the few in the country that can pull up this data. So remember who we take care of, very poor minority immigrant women. So we did a very simple study. We looked at breastfeeding rates in our hospital before we got the award, with the 10 steps in place. And these are our breastfeeding rates. Okay, sip of breast milk before they leave. So the way we did it, we took each year, we had a computer pull 200 random names that we did an audit of their feeding sheets. I hired a research assistant that didn't know what the study was about. Her only job was to count all those feeds. Then we put every baby into one of 4 groups. Before they left our hospital, they either got only breast milk, they got only formula, They got more breast milk than formula. They got more formula than breast milk. Then we could slice our breastfeeding rates any way we wanted for this group of 200 eligible to breastfeed term infants, not sick babies. Baby friendly is about term healthy babies. So sip of breast milk before they left our hospital, 58% got a sip before they left in 1995. It jumped up to 87% with the 10 steps in place. Statistically significant. So this means something happened in here. It just wasn't by chance, something happened. Then we said, yeah, but SIP, that's not a real breastfeeding rate for a hospital. SIP counts, so the mom who gives one and then stops, that's not a breastfeeding. We really wanted to know, what's our breastfeeding rate? You give more breast milk before you leave than formula, because I think those moms have a fighting chance to be a breastfeeder in 3 months. Look at this. We went from 34 to 74%. Again, highly statistically significant. I gave you all a sheet in that packet that has all our breastfeeding rates on it. Then we said, but exclusivity is the goal. How many babies left here exclusively breastfeeding? 15% of our mothers are teenage mothers in our hospital. Our exclusivity rate went from 6 to 34%. 1 out of 3 of our mothers, with our support, and as long as we didn't get in their way and we told them the right information, left exclusively breastfeeding. We were blown away by this. And then we looked at what the Surgeon General wanted looked at, which is U.S.-born African American women. Look at that, 34 to 74%. So we published this paper and we said the problem is us. The problem with breastfeeding in the United States, at least at our hospital, has to do with the healthcare system. And when you fix the healthcare system, our mothers definitely want to breastfeed. Absolutely want to breastfeed. Okay. So this is NICU data. We're on the same floor. Baby Friendly is not a NICU program, but if you do it, it spreads out. So you can see that our NICU data for the little teeny babies jumped up, jumped up. Look at this for non-U.S. born black. If you say, I want your warm skin, I want your breast milk, here's a breast pump, here's a voucher for a taxi, look at that. They went from 27 to 87%. So we now keep our breastfeeding rates every year at our hospital. So this is any SIP counts. This was before the Baby Friendly. This is with it in place. This is our breastfeeding rate at our hospital. I'm so happy to say we just did 2007 rates. We crossed the 90% point. 91% of our moms. This is more breast milk than formula. So we run in the high 60s, low 70s. This is exclusivity rate. We have to keep working on this because it's really hard to convince moms to just exclusively breastfeed. And then I just want to share, because so many people worked on this, and remember how we started with these pizza parties. In 2002, we got a huge award from the United States government that our hospital was picked as a best practice model for the nation. And of course, when we got that, we had a party. So I'm going to conclude with breastfeeding is just not a nice thing to do. It's a very important public health issue. Change is incredibly hard, especially in the healthcare system. And it's really, really hard when there's money attached to things. You need to start breastfeeding to keep it going. So what's happening in the hospital setting is really important. And I speak for the medical community that we own most of this problem, that the problem lies with us, and we have to look very seriously at what's going on. And I thank you, and I'll stop.